we've got Jen Bardsley. Jen is our nurse lead for climate and health environmentally sustainability at Fiona Stanley Hospital. Jen champions nurse-led carbon emissions reduction in the healthcare arena, driven by the belief that healthcare professionals are uniquely positioned to support their community to tackle climate change. Please welcome Jen.
My name's Jen Bardsley. I started nursing about 15 years ago down at Fremantle Hospital. And soon after starting, I was a bit horrified about the amount of waste that was being produced. And so I did a master's in sustainability studies at Curtin University with a focus on health-based decarbonisation, I guess. Nurses are the largest health professional cohort in the world. We have 450,000 of us across Australia. Thus, we can be powerful levers for change within the health system in regards to sustainability. And we are, as are many of our health professionals, trusted members of our community, and we can be part of the public discourse and a trusted public discourse for our communities, our patients, and for our colleagues. So this is an amazing diagram from the Department for Water and Environmental Regulation. I think it was produced last year. This diagram is projections under a modelling scenario if we keep current emissions as they are, high emissions, and by 2050, this is what we will likely have in Western Australia. And when I see that average temperatures will rise to about 2 degrees by 2050, I see patients walking in the front door. So we know that a rise in ambient temperature is associated with a rise in myocardial infarction. We know that it also has an impact on cardiovascular events. We know that a rise in ambient temperature is associated with preterm labour. So that's more mums coming in early and babies requiring the NICU. High intensity resource areas and areas that need huge amounts of staffing. And it affects many other areas of health as well. I'm also a urology nurse. We will have more patients with dehydration with a rise in ambient temperature. We will have more patients with kidney stones requiring surgery. And do we have enough surgery time available at the moment? Do we have enough theatre staff? Do we have enough surgeons at the current time? No. Do we have nurses to support them? Are there enough of them? No. Okay. So, God, that's a bit bleak, isn't it? Sorry, guys. I was like, gosh, not many people are smiling in their presentations. And I was like, I'll smile a lot. And then I'm like, anyway. So what's happening in the nursing discourse around this subject in Australia specifically? Huge amounts. We have the Australian College of Nursing have just sent a white paper to the Australian government talking about the nurses' role in leadership in this area. We have the Royal College of Nursing putting out statements left, right and centre around climate health and the nurses' role in leadership. We have the amazing Elith Award from Climate Action Nurses Australia and from the ACN publishing with her colleagues a lot of information, which is phenomenal. What are we doing here at South Metro Health? How does all of this stuff that everyone's spoken about so far today translate to nurses on the floor? What are we doing here at South Metro? Well, there's a few things that enable us to do great work in this area. One, we have an executive team that champion decarbonisation of our health service, and that is critical. If we didn't have that, we would have such a hard time doing anything in this area. We have a kick-ass, sorry for swearing, sustainability officer in Bridget Egan. So she's doing huge volumes across South Metro Health Service. And for those of you online, that's 4 big hospitals. And she is looking at system-wide approaches, capturing our data, justifying sustainability work, doing large campaigns across the hospital. We also have 2 of the only, if not the only in Australia, remunerated nurse lead for climate health and medical lead for climate health roles here. Yeah? Okay, so just a couple of examples of what we're doing here, how we can reduce our carbon footprint and reduce cost, okay? Because there is also, yes, we need to invest in sustainability and invest in staffing and pay for them, but there are also, for our financial people in the room or online, cost savings to be made here, and that can justify the nurse lead and medical lead roles when we're looking at embedding them into your services who may not have them yet. So up in the top, there's a woman holding 2 boxes. On her left, she is holding a white box. That box this woman is from the day medical procedures unit here at Fiona Stanley. That box costs about $4 or $5 per piece. They use it during the transperineal biopsies at somewhere to put some stuff when they're doing their procedure. I don't really know, sorry. And across here in her right is a box that comes with those blue little containers for free. Fine. So a wonderful nurse named Wayne Wheeler looked at this situation in the DMP storeroom and said, why don't we just stop ordering that one on the left that costs so much and just move those ones across to the other side of the storeroom. Done. They've saved $26,000 per year, and they're stopping purchasing an item which is likely being shipped from outside Australia and coming here on a truck. Sure, plane and a truck maybe, and a boat maybe, who knows? And so that is an opportunity for cost saving, yeah? If we look down here, the women holding the piece of paper. So in the urology department, we have multidisciplinary team meetings to discuss our cancer patients before they progress in their journey with us, yeah? So usually there's about, I don't know, 20 people in the room, maybe more. And for each of those people, we were printing maybe 20 pages or less of information about all of these patients to discuss. So because we have amazing leadership here and we have a team that has created an environment where you can create a local green group within your area, the urology team, nurse-led, initiated a green group. We looked at what areas can we improve our urology care? How can we decarbonize? And we looked at this paper and we thought, who looks at this piece of paper and what happens afterwards? And so we just decided to stop. So we just stopped printing. And we asked everyone, if you want to see it, bring your device, look on your phone. Everyone has one? Great. So we print one copy for the head of the MDT, and we've saved something like 20,000 pieces of paper for the year. So there's a cost saving. There's a cost saving on paper. There's a cost saving on the electricity it takes to make the machine work that prints it. A printer, that would be a printer. Sorry. Thank you. The toner, the ink, all of those things, yeah? And we have huge amounts of examples just around the nurse lead and the medical lead roles. The other thing about embedding those clinical roles into our workplace is that Bridget's doing incredible work as a sustainability officer. She's got our system-wide campaigns running, but getting that down to the ground and being able to communicate that to our nurses on the floor or our doctors on the floor who are under-resourced, understaffed, rushing around, you need to have a clinical person communicating why that's important and how to do it. Because nurses on the floor who are running around and have too many patients and they don't have enough staff, they don't have time. We need to have clinical people communicating this to our staff to help them and to show that we care and we see what they're doing and we can support them from the clinical roles, and so that they have a point of contact, a resource person. Another person who's doing amazing work here at South Metro Health is Anne Watts. She's the manager of the spinal unit here. She has created a incredible green group on her ward. She has spearheaded with one of our product liaison officers, Alana Monday, and with Bridget, transitioning the hospital essentially to using bamboo things rather than plastic things. Yeah, so that's had a huge, yeah. She's had a huge impact, and she's also implemented. So we have huddles here at South Metro Health Service, and so every second Friday, Anne has implemented a sustainability huddle. So she communicates every second Friday to her team around what is available to them around sustainability, what KPIs are they meeting for their ward. She has converted everyone on her ward, I think it's over 50%, to become green ambassadors. Yeah, so then over 50% of her staff are getting information every month from our sustainability officer around what's happening in sustainability land. Yeah, so it's front and center. She's doing huge amounts of work. This amazing woman over here, she's from our day medical procedures unit. That Duvalaki that she's holding in her left hand is a flipper-offerer. So she got engineering to do this so that she could take the caps off the glass vials so that she could wash them, wash the glass bottles and recycle them, instead of putting that whole thing into the clinical waste yellow box thing, yeah, which costs a huge amount of money to dispose of and is a resource that we could be reusing. We also got Grace Hitchens sitting in the audience. She's from DAC at Fremantle. Her and her team have implemented huge amounts of alternative waste streams and are dedicated as a group to personally take some of those waste streams and get them to the alternative waste stream place, and is doing amazing work and did so through COVID. A lot of the places on the wards that I go to, they're like, yeah, we were so green before COVID. They're not anymore because they put that aside. So yes, we have to do this for our patients and our communities that we are a part of. But the other thing is we need to look at this big picture. In 2012, my husband and I were traveling around the world, and we wanted to go diving in the Maldives. And so we joined an organisation, a volunteering organisation. We sent them our resumes and we said, we'll do whatever you want and we will come to your area for 6 weeks. So we went and we were assigned to Naifaru. Naifaru is an island that is 1 kilometre by 500 metres. 5,000 people live there. It's a 10-hour slow boat ride to the main island of Male, where there is a hospital and where there is tertiary education for their kids. So we went there, and as I'm a nurse, I thought that they would immediately send me to the nursing post and get me to do something nursey there. No, they saw my resume, saw that I have a master's in sustainability studies, and despite the fact that they are at sea level, they are feeling the impacts of climate change. It's here for them, yeah? And so they wanted me to create a curriculum, an environmental sustainability curriculum for their local school so that their kids could learn about climate change. This is 10 years ago. They have to take a 10-hour boat ride to the nearest hospital, and they wanted me to educate their children about climate change that they are not causing. So yes, this is important for our patients in our communities, and it's important for everyone, and we have resources and privilege, and we need to use it for them as well as us. Thanks.
All I can say is storytelling, role modeling. Who would want Jen in their sustainability team? Tough luck. She's an artist. Really appreciate your hard work, and it really comes across your passion. So thank you. Just thinking before Jen's presentation, we had Kim, and then we had Alex. This talk about modeling and planning for the future and making climate change BAU and accountability. We're not modeling, we're not health modeling for some of the stuff Jen talked about or Kim talked about. And we need to get onto it quite quickly because we're going to miss the boat in terms of funding.